In 2007, in Uppsala, Sweden, there was a head-on bus collision. In that collision, several people died. But amazingly, 56 people lived. And they were brought to the emergency department. And 5 years later, in a rigorous study, where the methodology is very impressive, they tracked down all 56 survivors. And when they interviewed these survivors in that methodology, the survivors really all remembered two things. One of those things was the pain of what happened to them, the pain of the accident and the pain of the care they got. And the second thing they remembered was the lack of compassion from their caregivers. And before you say, well, that was probably the specific hospital they went to, they were spread across 3 different emergency departments. So that's the two things they remember. One of them was the lack of compassion. Likewise, a study of 1,300 patients and physicians showed that over half of the patients and physicians felt there's a lack of compassion in the US healthcare system. And in one study that looked at all of the language, a transcript from a recording of all the language between surgeons and patients, only 1% of the language used had any elements of compassion in it. The question is, does it matter? Does it change outcomes? Does it matter if there's a lack of compassion in the US healthcare system? We call that compassion science, compassionomics. Here's what you're gonna do. You're gonna pick a song on here, and you're just gonna tap it out. All right, which song do you wanna do here? Everyone's gonna get it.
Okay.
I always recommend this one, just because it's the most common, but you can do whatever one you want.
I'll do that one, yeah.
This one, okay.
Second one.
What percent of people do you think you're gonna get it right?
I think after the first 4, they're most of them.
Yeah, so what, take
70.
70%. Okay, go ahead. Tap on there. They literally put this pad out because of the AV people one. Go ahead, tap. No, you use the mic and tap the mic.
Oh, okay, I got you. Wow.
All right, so you said happy birthday. How many people think it's happy birthday? Raise your hand. Raise it up high. All right. Anybody else have any guesses? All right, so thank you very much. What's your name?
John.
John, thank you very much.
Thanks.
All right, so it was the Star Spangled Banner. So don't feel bad, because that was an experiment done by a grad student in 1990 at Stanford, in which only 2.5% of the listeners got it right. But the tappers typically were between 50 and 70% of the time said about 50 to 70% of the people will get this right. That's called the curse of knowledge, right? John could not help but hear the song in his head, right? He could, it seems easy, right? And this is repeatable every time, right? So he can't help but hear that song. We often have the curse of knowledge in our head as administrators, right? That we're talking to people and we think the answer is so obvious for why we made a decision, but we have to communicate that to people. And I'll give you an example. We had a physician who for years has been pitching this idea to administration. His idea was that he's an interventional GI doc, so he puts scopes places that regular GI docs don't put them. And so other GI docs refer to him. So he knows all the docs in the community because they refer to him because we're a tertiary care center. He goes, look, I have this really great idea. Here's what we should do. And he talks even faster than I do. And he said, we should go to these community hospitals, and all the docs that get paid to be on call, we should go to them, and they can take all the easy things on call, but the really hard ones where you have to come in the middle of the night, those bleeders, they can get paid for the call, but we'll go in with our fellows and just stop the bleeders, and it'll make them real happy, and they'll refer us all our patients. Why will no one do this? I've been saying this for years. What's the problem with his idea? Why has every administrator always turned him down? Because it's illegal, right? Those guys are getting paid for the call. You're doing just the hard part of the work for them, just to induce them to refer to you, right? And every administrator knew it was, and no one actually told him. It was so obvious to them, they had the curse of knowledge. They were tapping Star Spangled Banner in their head, and he was hearing happy birthday, right? So you gotta be careful about the curse of knowledge when stuff becomes so obvious to you.